Prostate cancer is one of the most common cancers found in veterans, and if you served in Vietnam or other certain areas, the VA assumes that it's connected to your service. I'm Jenn Meyer. I'm here with Leitch, and we are with Parmele Disability Advocates. So let's talk about two big questions. Is prostate cancer linked to Agent Orange, and what happens to your VA rating when you're in remission? Is prostate cancer a presumptive condition?
Yes, and yes. It's no question about it. Easy answer. If you were exposed to Agent Orange, or you believe you've been exposed to Agent Orange in your service, then there's a connection.
How does that work as far as proving that?
If you were in country Vietnam, you don't have to. It's going to happen. It's on your DD-214, and that's all you need. This is one of the things that they adjudicate pretty quickly, and you're going to have a decision in favor. However, if you were not in Vietnam, or you were in like Thailand or the DMZ in Korea, the common one is if you were like along the perimeter of certain bases in Thailand in the Air Force, that's a connection. If you were a Navy ship in blue or brown water within a certain radius of land, then that's it. And then others that were added from the PACT Act.
So presumptive condition, that is the big term, is that they're saying you were there. We're going to just say if you have this issue because you were there during that time.
Yep.
Say you have the prostate cancer diagnosis, you get treatment, whether that's chemo, radiation, whether you have a prostatectomy. What happens after you're in remission?
The VA, according to their manual and the CFR, they're going to reevaluate you 6 months after that. What does that look like? We don't know. It's I've been in communication directly with the VA on this. There's not a direct way. There's some veterans that they see when they're adjudicating these claims, they're making a decision on the claims. If they see that they're in stage 4, they're going to make it static. What does that mean? It's not going to change. That's just what they're going to give them, and there's no reevaluation. And then it's on the burden of the veteran to ask for a reevaluation if they actually do beat the cancer. But other than that, they're going to set it for 6 months after remission and reevaluate you then.
When does the 100% rating stop?
As soon as you're in remission.
Okay.
However, there's some caveats to that. If you file a claim for prostate cancer, as soon as they adjudicate the claim, you get that rating decision in the mail, and a week later you are in remission. If it was me, I wouldn't go yelling to the VA, hey, lower my rating. They're already going to set that as a schedule, so they're not going to take that back. They're not going to retro that pay. Let it ride. Let it go.
Let's talk about residuals. Most people probably know what they are, but why don't you tell us about them?
Sometimes as a veteran service officer, I had these awkward conversations all the time. They weren't awkward to me because I see prostate cancer so much. I usually, of course, liked it when the spouse was in the room and has had these conversations. One is really just very awkward is the urinary incontinence. No grown man wants to have that conversation. It just, you have to. You don't have to with us or your veteran service officer, but just be honest when you have your evaluation. That's going to help you significantly. Another one that's really awkward is erectile dysfunction. It's one of the things that happen.
It is what it is.
Yeah. Or kidney and bladder damage, another thing. And your doctor's going to evaluate you on all this. Just be very open with your doctor and make sure you tell them what's going on. And the last one that is very, very often overlooked, and that's their psychological impact. You're going to have it's going to mess you up some. Psychologically, you've been diagnosed with cancer. If you're not already service connected for some kind of mental condition and you're going through this and you're dealing with some of that, don't be afraid to tell a VA, even when you file for your prostate cancer, put on their mental condition. Let the VA figure out what that looks like and how to rate you.
After remission, what can your rating be? How does that look?
Yep. After remission, it's gonna go away from that 100%. I've seen anywhere between 60 and 40. It can go as low as 20%. Probably 40% is your good average. It all depends on what we just covered, all those different things, how all of those are affecting you. The lower, the better. Listen, I don't want you to be rated at 60%. That means you're really struggling with some things, and that sucks. Money disappears when it comes down to dealing with those kind of things. Let's hope it's 0, but your most average, it goes down to 40%.
If anything can be done to protect your rating, what would that be?
Keep records. Just keep records of everything, especially if you're going to a private position. The VA is not going to know. If you're going to the VA, they can pull those records straight from the Veterans Benefit Administration, from the Veterans Health Administration. That's easy, but keep your records. Don't miss your CMP evaluations. Go there, be honest, be early, and make sure that's taken care of. And if you feel like your rating isn't high enough, if you feel like your rating isn't reflective of what your symptoms are, reach out to us. We'll help you appeal that and get that higher rating.
Let's just do a quick recap on this. If you have prostate cancer and you served in Vietnam or other exposed areas, it's presumptive. You don't have to prove it. It's already been done for you. And after remission, the VA is still going to pay you and compensate you for the lasting effects or residuals of your cancer. So if you need help with this, that is what we're here for. Our VA team is ready to sit down with you, dig through the weeds, and determine your next best steps. If you're wanting to appeal a denial for this already, or if you're just looking to increase your disability percentage on that, maybe things have gotten worse or new symptoms have developed, new residuals are appearing, we can help you with that. Call us at 866-889-2570 and ask for our VA team, and they'll help you determine your next best steps. Don't forget to share this video with someone else who may find it useful. Thanks for joining us today, and have a great afternoon.